this is Tim from ChiroUp, and I'd like to show you 3 essential skills for managing lateral epicondylopathy. Earlier this month, the Journal of Hand Therapy said that there's compelling evidence that manipulation and mobilization help with grip strength, pain, and functional outcomes. What they found is that manipulation of the elbow is best for managing the pain. So the way that we perform manipulation of the elbow is Mills manipulation. We have the patient sitting. We want to make sure that they can fully extend their elbow and fully flex their wrist. Once we do that, we're going to move the patient's forearm into internal rotation at the shoulder, forearm pronation so that their olecranon is facing up, and full wrist flexion. I'm going to contact the radial head with my thumb. I'm going to perform 1 or 2 oscillatory mobilizations just to get the patient comfortable. We're going to have them tip their head toward the side to take the pressure off the radial nerve, and then after a couple of oscillatory mobilizations, I'm going to apply a quick thrust. That's going to perform a manipulation of that joint, and that's the best for reducing pain. Now, the journal also said that when it comes to improving grip strength, mobilization with movement was most effective. The way this happens is we're going to have the patient lie on their back. They're going to be in a supine position, and we're going to have them rest their forearm off the edge of a table. It's going to be pronated. We're going to have them loosely gripping a rolled towel. We're going to place 1 towel underneath their tricep on the table to create a little bit more ability for extension. And then I'm going to place 1 hand underneath their elbow. I'm going to place the other hand on their forearm and perform a downward mobilization, just taking this from 5 degrees of flexion into full extension. This should be pain-free. If it's not pain-free, we might allow the patient to have a little bit of supination. So at terminal extension, the patient squeezes a towel. So I'm taking it into terminal extension, the patient squeezes. They're going to repeat 3 sets of 6 mobilizations. So that's the best exercise for improving grip strength, and we're also going to send the patient home with that exercise. So the patient's going to be standing. They're going to place their arm up against a door frame with a towel behind it to create the ability for more extension. They're going to take their other hand and contact their proximal forearm and apply just a gentle terminal extension to the elbow, and at terminal extension they grip the towel with a good amount of force, relax, come back into a slight degree of flexion, force it back into extension, and grip the towel. 3 sets of 10 with that exercise. Now the patient has the tools at home to help make themselves an active participant in their recovery. I hope that you enjoyed this video. I hope that you can employ those 3 tools, the current best practice management of lateral epicondylitis, and I hope that you'll continue to work with us to make chiropractic the undeniable best choice for patients and payers alike. Thanks for watching.